Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today I'm going to explain integumentary system case studies, and many of my students also going to write exam by the year end, since we have only 4 months left. Many are planning to write CPC exam, but it's been a few, like they have taken training maybe in January month or February month, and they also need kind of revision. So I thought, let me explain case studies so that we can cover more concept also, and for you people also it will be useful. Okay, so that's why I'm creating or I'm recording this video. So in this integumentary case studies for today, I have taken two case studies. In that, we will be covering around four important major integumentary concept along with appropriate diagnosis coding as well CPT coding. I will also show you what will be the correct ICD code for the particular given question. Okay, so also if anyone wants to join my complete online CPC training for 2 months, you can WhatsApp me. My new batch will be starting from September 4. And if you need any kind of interview material or CPC mock preparation for your own, study purpose, you can visit my website, and you can purchase and you can download the material from there. Okay, so yes, please do watch video till end, and if you like the video, you can share with your other friends as well, and subscribe to my channel. So let's begin. We have case one. So whenever you are looking into case study, make sure you are reading complete entire note. So we have pre-operative diagnosis, we have post-operative diagnosis, and always identify, do you see any difference between pre-operative versus post-operative? Okay, because pre-operative is before the surgery, post-operative is after examining, like after doing surgery. So sometime we will have a different, diagnosis here. So, but here in our case, preoperative diagnosis says rapidly enlarging suspicious lesion of the patient right forehead. So, the patient is having suspicious lesion on the patient right head. So, anatomical site is clear, it is right forehead, and post-operative diagnosis they have given the same. Okay, nothing changed. Then operation performed, the wide local excision with intermediate closure of right forehead performed. So we have two procedure here. One is excision plus intermediate repair. So you already know the coding guidelines. So excision plus simple repair for the same site. Then you cannot code simple repair separately, because simple repair will be an integral component of excision. But if you get intermediate repair or a complex repair, then you must code them separately using an appropriate modifier. Okay, so here anyway directly they have mentioned as intermediate. Sometime they may not tell you what kind of repair they have performed. So you need to read the documentation, and you need to, understanding the severity, you can decide what kind of repair they might have performed. Okay, so now read it to the indication as well procedure. So I'll be reading whatever I have highlighted. You can pause the screen and take a moment to read completely. So here, mainly the patient was placed in the supine position on the table and given no sedation. The area of his right forehead was prepped and wrapped with bethadine with a sterile fashion, and this area to be excised. So right forehead is, that forehead area is going to be excised. So they are saying the area to be excised was on the right side of the patient, mid forehead. This had a maximum diameter of 1.1 centimeter. Okay, so we have a lesion diameter here, that is 1.1 centimeter, and we have a margin 0.3 centimeter margin. Okay, so you have a lesion 1.1, margin 0.3 centimeter. So then you should know what will be your final excision diameter. Okay, so they have already given the total resection of 1.7 centimeter. Okay, how it is 1.7 centimeter? You know the guidelines. You have excision. So in the excision, You can look into any of the images. Yeah, so you need to check what is the lesion diameter, and then you need to add both side margins. Okay, in our case, we had 1.1 centimeter lesion plus zero point 0.3 plus zero point 0.3 both the sides. Okay, 0.3 you will be getting 0.6 as a margin, plus if you add this 1.1 lesion diameter together, you will be getting 1.7 centimeter. Okay, so they have made it very simplified. So they only have already given this, you no need to calculate also, but sometime they may also ask you to calculate. Okay, so that you should know the excision concept fully. So here we got the total resection of 1.1 centimeter, and then next coming to, see, then you can see the wound was then irrigated. Irrigation, whenever you see irrigation or cleansing or removing the foreign body or using layered closure, these are all refers to intermediate repair. Okay, not the simple one. So here irrigation is there, and several bleeders were tied off and then closed in a multiple layers. So it says they have used intermediate repair. Okay, and the intermediate repair also, the total length of the repair was 3 centimeter, and this was covered with the steri strips. Then patient is tolerated the procedure with no complication. So they have said here steri strips, but they have also said, you know they have used the sutures. So only steri strips means we should not code, but there is also suture details. We are going with the intermediate repair code as well. Okay, so for this procedure you need to code excision plus intermediate repair code, and the diagnosis is, you can see the keratoacanthoma and possible squamous cell carcinoma. So whenever in outpatient coding or for your CPC exam, if they refer possible, probable, suspicious, okay, all of these terms you cannot take it as a final diagnosis. So you can't code for possible squamous cell carcinoma. You have to code for keratoacanthoma. So keratoacanthoma, if you just go and check in the alphabetic index, you have the ICD code as lesion code. Okay, and also here first let's find the CPT code. So go to lesion, excision of lesion. Under excision of lesion, you need to identify whether it is a benign lesion or a malignant lesion. Okay, but if you read your complete case study, they have not mentioned anywhere that they have found this lesion to be a malignant. Okay, they are only specifying that suspicious lesion. And if you go by keratoacanthoma, complete, you know, uh, medical condition, it will lead to the lesion only. Okay, so normal lesion we just consider as benign. So you have to code it from benign CPT codes. Okay, benign CPT or benign lesion excision. So our location is, so under benign, our location is right forehead, right? So for forehead, yeah. So here you can check excision of other benign lesion, including margin, except skin tag on face, ears, eyelids, nose, lips. So we can consider this as other benign lesion, and head belongs to face. So below to that, look for your final diameter. So you got 1.7 centimeter. Okay, total resection, including your lesion diameter plus margin, you got 1.7 centimeter, and the area is face. So if you check, you will be getting for 1.7 centimeter. Okay, 1 minute. So here you can just look and identify what is the code you will be getting. So we have 1.7 centimeter so that you will be getting 11442 as your CPT code. Okay, this is your CPT code for the Excision. Okay, so you got one CPT code as 11442. This is your CPT code. Okay, for Excision. So next you have to use the intermediate repair. Intermediate repair was 3 centimeter. Then go to location is right forehead, again face only. Okay, so I'll just go by page number. It is repair 124. Okay. Okay, so you have the repair. Under repair, come to intermediate repair. Look for your anatomical site. Anatomical site was face. So you have the face here, but you have 3 centimeter as a length. So 12051 covers only 2.5 centimeter. So you have this intended code 12052 2.6 to 5 centimeter. So that you will be getting 12052 as your CPT code. Okay. So now you will be assigning one more code, CPT 12052. Okay, 12052. Then you must utilize your modifier. Okay, 1 minute. So yeah, so I was referring 1141442 was Excision, 12052 for intermediate repair. Okay, so then to have proper billing usage, you must utilize the modifier. Okay, so the modifier you will be using 51 modifier. 51 modifier because it says multiple procedure. Since both procedures are they are from the different header. Okay, one is Excision, one is intermediate repair. It is from repair. We will be using 51 modifier, and that too very important thing, how we should code, right? It should be sequenced in a manner. Just a minute, I'll show you. First you need to code integumentary code. Okay, 12052 because it will have more RVU. Then you will code 11442 and then you will use 51 modifier. Okay, I think it is visible for you. Yeah, like this you have to code 12052 11442 with 51 modifier. This is your CPT codes for this case study. Same way, ICD code if you want to check. Already I told you this is possible squamous cell carcinoma. So you cannot code for a possible condition. So just go to this keratoacanthoma, whatever the code you will be getting. Okay, that will be your ICD code. So I've already, so you can see L85.8, this is your ICD code. So how you can find this code means go to index, okay, directly go to K terms and find the word complete medical condition as keratoacanthoma. You have L85.8. Okay, so this will be your ICD code L85.8. Okay, so mainly here we were we able to understand about our CPT excision concept as well intermediate repair. Okay, in the place of intermediate repair, if you got any simple repair, do not code it. Simple repair is always an integral part of excision. Okay, for the same site. If you have a different site, then we need to code separately. But for the excised site, if they're using simple repair to close it, then simple repair you cannot code it separately. Okay, These are the two concepts. Then let's also understand one more case study. Another case study we have regarding Mohs surgery, and also by reading we will understand what else is included. So just see, preoperative diagnosis is basal cell carcinoma. So you can look into this case study here. They are very sure that patient is having basal cell carcinoma. Okay, it's not a suspected condition, but it's a confirmed diagnosis. Post-operative also same. So for diagnosis, you need to code for basal cell carcinoma only. Then Mohs surgery they have performed. So patient has a biopsy, proven basal cell carcinoma on the nasal tip. Okay, so your location is nose, or basal cell carcinoma means nose skin we will refer. So then Mohs surgery indicated that surgical procedure was explained. Then just read it completely. Okay. Stage 1. So Mohs surgery is based on stages. So you know that. Okay. So I will also show that 1 minute. Mohs surgery. So Mohs surgery have 5 codes. Okay. Mohs surgery means Mohs refers to a single surgeon should perform both surgery and pathology section. Then only we consider it as Mohs. So under Mohs surgery, you have one stage code and another additional stage code. In same way, stage and additional stage code, and these code varies based on the anatomical sites. Okay, and again you have one more additional code. It is a block tissue block code. Whenever we go beyond 5 tissue block, you have to take 17315 as an add-on code with any of the above codes. Okay, with the primary codes you will be reporting. Okay, so now like in classes I have already explained in depth about all the concept that we are now referring. So now it's just a revision, so I am not going in depth. Instead I am just keeping you on track on what is important and what to focus in your case study. Okay, so here as they said, Mohs performed, sorry, this is a case study. Okay, Mohs performed stage 1, and stage 1 include how many tissue block you have to check. So stage 1 includes, okay, tissue was divided into 2 tissue blocks. So you have stage 1. In one stage you have 2 tissue blocks they have taken. Okay, so what is the location? Nose is the location. So simple. Now you will go to Mohs micrographic surgery. Look for the location as nose. Okay, so coming down in 17311, you can see you have what is the location? Head. So head is here. Okay, so here it comes, nose is involved here only. So you will be getting 17311. Another stage code you can check those anatomical sites as well, but you will be getting 17311. Since you have only one stage, you have to report only one code, 17311. And you know that this stage also covers up to 5 tissue blocks. So anyway, you have only 2 tissue blocks. So no need of coding any add-on codes, no need of coding any additional stage, no need of coding any additional block code. Only one stage code along with the block information. You will be using 17311 for the Mohs micrographic procedure. Okay, then comes to, then okay, let's keep that CPT 17311 will be coded, okay, for Mohs micrographic. Then go into the last line. Okay, so which are then mapped, and then the technician for frozen section tumor was then, okay, so then you can just see here on the same site with the 10 into 13 of subcutaneous tissue, the closure is closed by Burroughs graft. Okay, Burroughs graft means we like this grafting is included in adjacent tissue transfer. Okay, it's like what to say, it's a reconstructive technique, and this uses a tissue from an area which is very adjacent. Okay, to cover those surgical defect, they'll take from the close adjacent area only. So this is also a type of adjacent tissue transfer. So now you understood. They have also performed ATT procedure. So go to ATT procedure. Okay. So adjacent tissue transfer or rearrangement. Now in this concept, you already know what to check. So the coding points are, you need to check what is the anatomical site and the square centimeter, the primary defect and the secondary defect, and together totally how much defect you have. All those you need to check. Okay, so now we have a location being nose. So for nose, you will be getting again forehead, cheeks, chin, mouth. Yes. Okay. And then, so this is 1406041. Then coming to 4060, adjacent tissue transfer of rearrangement, eyelid, nose, ears, lips. Okay. So nose is here, so that you will be taking 14060, but again we need to check the square centimeter, right? So the square centimeter should be, just go back and look into the square centimeter, how much you will be getting, you will understand. Okay, okay, it is 10 into 13 mm. Okay, not the centimeter here or the square centimeter, they have given in the mm. Okay, that means for what to say, 1 centimeter we will be, okay, not, so for 10 mm we will be getting 1 centimeter. For 10 mm we will be getting 1 centimeter. Okay, so then consider one defect is 1 centimeter, and another one we have only 0.3 centimeter, right? So that you will be getting 1.3 centimeter, 1.3 centimeter. So that means it will come less than defect, less than 10 square centimeter only. Okay, so your code will be 14060. Okay, 14060. So go back and code for 1460. Okay, then you have another code 17311. Again you will be reporting 51 modifier. 51 modifier says multiple procedure. In order to code both of these procedure, you must need 51. Okay, so these are the two CPTs you will be reporting for case 2. Then coming to diagnosis, ICD, it is very clear. You have basal cell carcinoma on the nose. Okay, so nose or nasal skin. So basal cell carcinoma code will be, I will just, so if you want to go and find the code in a proper way, go to like table of neoplasm. Before that you need to go to alphabetic index. Okay, but now just go to table of neoplasm and look for the, I think, skin maybe. Let's see. Okay, see skin, under skin. Yeah, so see here under skin you got skin. So skin of nose. So nose skin will be C44301. No, wait. Basal cell carcinoma, right? We have to Just basal scan. No. Yeah, sorry. It should be C44. Okay. Should be 344, 311. So you can see 301 says unspecified malignant neoplasm of skin of nose, but unspecified not the code, because we have the specific information as basal. Basal cell carcinoma. Where I missed? 1 minute, okay. So it should come. Okay, so actually this we have to go back to alphabetic index only. From alphabetic index you need to take the reference. Okay, so you have to go to index, and then we need to navigate to like basal cell carcinoma, so which will lead to C44311. Say basal carcinoma, skin of nose, C44311. This will be your ICD code. Okay, so I was referring through book, and I noted the page. So here in software it is leading in a different way, so that's okay. In exam you will have options, right? So just look into the proper description of the code, C44311. So this is your ICD. Okay, this much you need to code. So I think both cases I have explained clearly. So these 4 concepts are very important. Okay, coding guidelines also very important. So please note that. And if you are not understanding the basics or the coding points, just refer the given direction in the book. Okay, it will help you. Or I only covered a lot of videos earlier. Check that also. Okay. So if any one of my students writing exam, please do keep me informed. Okay, so that I can assist better. So thank you all. Thank you for watching this video. And if anyone is preparing you for exam, definitely these case studies will be helpful for you. That's why I'm uploading here. So thank you all. Thank you for watching.